Hello everyone, welcome back to my YouTube video channel, Today Dental Magazine, Today Dental Medicine. Thank you for joining us today. Today I have another presentation to help you guys, those of you who do orthodontics or are starting to learn how to do braces. Join me to learn something today. Let's jump right in. I'm going to share the screen and we're going to discuss about an orthodontist case. This is something that I've been working on the case for the past couple of years. So let's just me share the slide so we can go right in. Again, guys, thank you for watching. And if you, by the end of this presentation, if you feel you enjoy learning some of these presentation from my case, don't forget to subscribe and hit the like button. Also share to your friend who's starting to learn, especially those of you who just graduate in the past 5 to 10 years, and you want to grow your practice, you want to do something besides just general dentistry, extraction, filling, crown, and brush, and even implant, guys. If you want to combine between implant dentistry and braces, then it's a great things to do. I've been doing this for a long time, more than 10 years in braces, and same thing for implant, more than 10 years. I've been practicing close to 18 to 19 years. So it's been a blessed. It's been blessed for me to adapt to this kind of clinical skill. Help me out to improve my patient care, personal care for my patient, instead of getting referred back and forth, and you don't have a chance to build a rapport with the patient. So without further, I just want to go in and talk about this case. So this is the case that an adult patient come into my office. He's in late 30, as you can see, actually be in the early 40. As you can see that his teeth, this is how he smile, okay? The lip doesn't seem to feel like a natural smile because he's trying to hide something. I want to show you a couple more pictures. This is just simply to show you the progress. So I want to make sure you see the case clearly. So this is before we started. Patients have very interesting mouth. Okay, you can see that the number 8 seems to be longer and bigger than number 9, and also he's missing number 11. What happened to number 11? Well, he does have number 11 inside his upper here, but it's because of his age. He just wanted to remain the tube there, no extraction, no exposure and pulling down. He just wanted to simplify his treatment. We did give him an option of remove, expand, and all of that, but I'm going to talk more about that. So let's talk about the problem with this patient. When you look at the patient internal amount intraoral photo, you can see that the midline is off. There is something missing there. There is something shifting to the left. That's because the number 11 is missing. So again, number 11 missing, everything starts shifting to the left side. And also on the bottom, as he also doesn't have enough room. So you can see that his teeth is really crowded in the front tooth here. He did have some restoration in the back. Also a restoration on the number 4 and 5 area. These are the conditions that it would make you be aware before you start your braces, because it's actually even more difficult to do braces when you have porcelain teeth, because the brackets doesn't bond very well. So this is a challenge right here. Number A is 5 and for. The good thing is when you evaluate the patient case, evaluate the potential of whether you need to move the teeth or you don't have to move the teeth. When you don't have to move the teeth, then you don't have to be in fear, because the tooth can be stay the same. So let's see tooth number 4 and 5. You don't need to move anywhere. It just stay the way it is. Okay, on the right side, it looked great. And on the left side, you can see that everything starts shifting forward, and everything starts, anterior teeth start shifting posteriorly, and posterior teeth start shifting anteriorly, so to close the gap of number 11 here. So this create a very nice gap being closed there, but the thing is, it create the class 3 molar, class 2 molar here, and basically class the everything shift forward here. So you can see that there's no canine guidance on the left side here. So this is how he smile. If you look carefully, this is how he smile. His lip on the upper look kind of like in the middle, but then it starts shifting on this side. Why is this? Because as you can see right here, the super erupted on number 20. Sorry, I'm gonna go back. Super erupted up to number 23, 24, and also the number 25 and 26 is facially rotated. So that's why when he closed, the first thing it hit is these two right here. So that's it is tube number 25 and 26. When he close together, this is the reason why you can see there's a lot of damage on number 25 and 26 compared to number 23 and 24, because linkly inclined, right? So that is something that you understand, that these are linkally inclined. This is 23 and 24, and these are 25 and 26. Again, you have to evaluate everything before you decide what you want to do for the patient. So again, this is a case where even being an orthodontist, he still gonna have a hard time to figure out what to do, because he need to ask an option for the patient, whether the patient want to do implant, expanding this art, take out the tube number 11 that inside the jar, and expand this space and put the implant in, or he's closed the gap and just basically straight the teeth. The option is whether you are a young orthodontist or a long-term experienced orthodontist, you still have to consult with implant dentist, oral surgeon, and the dentist himself to whether what the patient want. Now, when we talk about this, it comes down to experience, and it's come down to evaluation the patient tongue, the patient facial profile before we move forward to what direction we want to do. After we discussed with the patient everything, we told the patient that with his age, the best thing to do is just simplify the case and reduce the time in the chair for so long. So to do that, my goal for the patient and his goal is basically straight the bottom teeth out and trying to correct the shifting of the number, the left side a little bit toward the right side. That's way his smile look reasonably acceptable in his eyes, and the people opposite who talking to him look acceptable. We're not going to change anything beside that. So that give a lot of comfort, because we explain to patient the risk of extract the tooth and implant and the space and the extension of the orthodontic treatment can be a lot very difficult. So this is the reason why we have to give all the options to the patient, as well as we also have to confidently understand the age of the patient, the expectation and the goal and the vision that you want to, what the patient want, what you want to do. So let's continue. So again, we just basically trying to align top and bottom teeth and make it look pretty. Now, so as you continue the case, you can see there's a challenge. His midline is completely off, and the side of number 8 and 9 is not even. It's very, very stressful when you see something like this. But you gotta be patient, and you gotta know that if you patient with braces, the braces will give you a beautiful smile. So this is the reason why I'm very, very thankful that I am been doing this for long enough, that I'm patient enough, that I know that the case is going to turn out better and better. So that we do go along, we basically do a lot of shaping and reducing the interproximal contact and create the even the balance between number 8 and 9, and also the bottom tip here. So we do a little bit of enameloplasty as we go along. So this is just like continue the case. Next thing you see that if you compare from where we are beginning, starting, getting some result after 11 months to, almost a year and a few months, you can see the great change of his smile. You can see there is a balance of the lip on the top and bottom of the lip, look more even. And you can start seeing that the top and bottom teeth are aligned together. So that's the key. Getting better each month, and you have to be patient again. If you do braces, you have to be patient. You cannot rush the case. So this is before, and we can see the progress. And you can see that I used all type of elastic, class 2 elastic, cross art elastic. You can see from here, we're trying to put him where to ship the jar on the bottom tip. Actually, so trying to ship it midline at the top a little bit more toward the right side, and also trying to pull the lower jaw on the right side to the left side, so we can correct a little bit of midline. Very difficult, very difficult. All you can do is have the patient wear elastic as much as you can and hope for a better improvement. So I don't expect to have a great midline correction, because unless I take out, I expand numbers, the space between number 10 and number trial, in order for me to give a perfect midline correction. Otherwise, it's not going to happen. So this is, again, this is before, and this is after several months later. This is like 11 months later. You can still see that the number 8 is bigger than number 9. Can be frustrated. Gotta be patient. Now, you also noted that I told you that number 4 and 5 are crowns, so it's very difficult to put brackets on. And I saw at the beginning it was stable. I don't want to change anything, so I didn't even need to bond on those teeth. I tried before, it failed several times, so I'm not going to rebond it again, waste my time. Continue the case here, that this is starting tube number, starting the beginning, and now we can see that there is some improvement after almost over the year and a half. So you can see bottom tube and top tube are truly aligned. What we're trying to do, we're trying to bring these even tube number trial here to be in the position of close to a canine, and make it look like the canine. And eventually, if the patient want to be having the even length, we can do a little bit of gum gingivectomy on here, and probably gum graft here if he want. Other than that, it can be all up to the patient. So this is before, and this is several months later. On the bottom teeth, you can see it's getting straighter, but you can see what it happened is we create the space here, then we flare out the teeth to create room. I do not like the idea of interproximal stripping of the teeth. I might have done a little bit, but I do not want to do so much to avoid like roughness between the teeth and also stain later on. So you can see this before. There's a little rotation here on tube number look like number 6, but actually not. This is tooth number 10 right here, rotation. So we have to correct that. It's because this is the mirror imaging of the occlusion, so it doesn't look, so it can fool you, but this is tooth number 10 right here, okay? And this is 4 and 5 right here that I was talking about. So you can see now the arch seems to be a little bit more ovoid with even distribution. Again, this is after smile, big difference. This is before, and you can see the lip are very consciously shy about his smile. But look at this now. Naturally, he smile with even smile now, and so this is something I'm excited to just share with you. So, general dentists who want to learn dentistry, you can do it. Be patient, work hard, and have to have somebody train you, mentorship, and follow up with you. And that's the key. So this is before, and this is after on the right side. This is before facial straight shot, and this is after. This is left side, and this is left side after. Eventually, these black triangle will fill up with the gum. So this is just progress here. Again, this is a finished case. This is before, this is after. Before, after, you can see how evenly distribution. The midline we could not correct. We told the patient he would trying to wear cross art elastic and all of everything, do some interproximal strip here and there, but this is the best we can get. Okay, this is the open mouth picture. You can see it get more even now on the bottom teeth here. We might do a little bit of composite here to make it perfectly looking good. Other than that, K is finished. I just want to show you again. When a patient comes to your office, this is her smile. Do you think you can give the patient something like this? Yes, you can. Everybody can. You need to just get the mentor and learn how to place practice properly. Even this case, probably Invisalign can be done as well. So I'm challenging you guys, trying to learn some new stuff every day. Again, just want to show you quick before and after, before and after, before and after, and something to think about. If a patient walk to your office, can you help the patient this way? Especially those of you who live in like a rural area where there's very small population, there's no orthodontist. What can you do for this patient if he wants to turn his life back to a beautiful smile? Thank you for watching. I hope you enjoyed this video. If you have further detailed questions, feel free to email or make comment below, and I'm more than happy to interact with you. And if you like it, share with your friend, subscribe to my channel. I want to see you next time. Have a great day. Bye-bye.